I have to fluff up my hair too. Welcome to this week's version, of the Yamhill Leadership Roundtable. It's good to see all of you with us today. We're going to talk about vaccines. We're going to talk about affordable housing, I think. We're going to talk about anything that Al prompts us to talk about. And maybe we can even talk about internships and the Mac Works. Is that what it's called, Scott Cooper? Or well, you'll get to it. But we'll do introductions. Don't worry, we won't. I'm not going to put anybody on the spot. We have Remy Drapkin, Council President for the City of McMinnville and new board member on the Oregon Wine Board. We have Councilor Kelly Menke, immediate past Council President for the City of McMinnville. We have Al Bannon from Representative Bonamici's office. Thank you for joining us. We've got Scott Cooper from McMinnville Economic Development Partnership. We have Steve Sugg from Dayton School District, our superintendent. Welcome. We'll have questions for you about vaccines. Or maybe we'll have commentary. And then we have Abisha Stone from DEDCOR. Welcome, everybody. And I'm still struggling to get Mayor Watkins to join us. So we'll see what happens when I push the magic button again. But to get us started, I wanted to note that we have made progress in our county in reducing case counts. Huge. It's so exciting. And, in other times, going from a week of or 2 weeks with 100 cases to 2 weeks of, 50 cases, like that's significant. But we're talking about going from 475 new cases over 2 weeks. We're down to, I think, 240 new cases over 2 weeks. And that's a significant improvement. So I just want to shout out to everybody who continues to make sacrifices, including the business owners who don't want to make these sacrifices. And we'll get to that next. But I just wanted to put that out there that we're really making progress in our county and across the state as a whole. Case counts are going down. Hospitalizations have very slowly ticked down as well. But in our community, we continue to see community members die. And it's heartbreaking to me, especially because of how challenging it is for families to mourn. So out there, if you can just take a moment to think about these folks who have such a challenging time ahead with a disease that continues to be among us. And we'll talk about vaccines in a little bit, but I want to make sure that everybody gets a chance to share with the community what's going on for them. And to that end, I'm going to start with Council President Remy Drapkin. Remy, what do you want to share with the community today about COVID, about vaccines, about affordable housing?
Well, thank you, Commissioner. I actually would love with you to ask a question that I know is being asked broadly in the community, which is that you will continue to share access to information regarding vaccines. We know that the county website is available, but there's still a tremendous amount of confusion and just a lot of chatter when folks don't know what information is valid or not valid. So, I would kind of send that back to you. I will follow up with what started in this meeting a number of weeks ago. Councilor Menke and I were able to meet today with a number of our nonprofit housing leaders, as well as representatives from our federal delegation, and start working towards kind of a next steps plan. And that next steps plan is another meeting with those who are involved today, but then also with representatives from the USDA and HUD, so that we can start translating some of the specific problems we find for McMinnville, but affect all of Yamhill County, which a lot of funding problems that we have in terms of affordable housing relates back to our population size. So we find ourselves in a gap where there's often not funding available for cities with populations below 25,000 or below 35,000. It's that threshold exists for a number of grant and funding opportunities, pushing us away from rural funds. And similarly, funding for large cities often has a minimum threshold of population of 50,000. So McMinnville, as a city of 35,000, we find ourselves in a funding gap in regards to federal dollars. So we just had really one of the best Zoom meetings I have been to from all of COVID. It was a lot of really busy people who talked really quickly and got a tremendous amount of information shared around the table over the course of an hour with clear next steps. So thank you, Commissioner, for providing the forum that came out of. And we have a city council meeting tonight if anybody would like to tune into that, but I think I'll just leave it at that for now. And thank you.
Thank you. That's super exciting. It's unlike the Goldilocks where it's not too hot, not too cold, just right. In this case, the just right is not right. So I'm really hopeful that we can all find something that works. Regarding the vaccine, the state of vaccine distribution in the county, the county has just finished or officially finished phase 1A, the first round, which is frontline healthcare workers, folks in long-term care facilities, and first responders, home health aides. It's a very broad group, which is why it's taking a while to get through it. The state has officially allowed us, starting today, to begin vaccinating phase 1B, which is teachers, childcare providers, and staff at school districts or schools in general, so public schools, private schools. In addition to that, starting February 8th, the county will be allowed to begin providing vaccines to folks who are over 80. And I do want to clarify that people who are in long-term care facilities, if they're over 80, they've already had their opportunity and they can continue to be eligible. They will be able to get a vaccine as soon as they want to. And for people who are over 80, and really for folks in general who are essentially homebound, they're independent, but they have somebody coming in to help them, help take care of them on an ongoing basis. They are also currently eligible through phase 1A for the vaccine, as well as their caregivers. And those are really important notes because a lot of people are like, well, what about me? I live independently, but somebody comes in. The important thing is that if you have a question, call public health, and I'll pull up the phone number and I'll read it aloud in a moment, but I need to just focus here. If you have access to email, you can email public health with your question. It's COVID, COVID, at co.yamhill.or.us, and they can help you guide you through the process. That's the same email address to use for school districts to communicate with Yamhill County Public Health to coordinate vaccinating teachers and staff members. So right now we've finished phase 1A officially. If there's anybody who continues to be eligible, they simply need to get a hold of public health, and public health will get them on the schedule. There's also a way to stay proactively engaged, and that's by signing up for their email newsletter. I'll put the link in here. But if you have a search engine, you can just search Yamhill County HHS vaccine, and you'll get to the sign up form for it. And it's just an email and your name that gets you on the newsletter list. As well, Yamhill County Public Health has put out a press release now on a regular basis updating the community, and that press release goes directly to folks like the News Register. So it'll be in as many forms as possible. But before I get to your question, Councilor Drabkin, I think the really important thing to remember is that there are always people who can't access those things, those different communication platforms, whether it be because of the language barrier or because they can't, they're not as literate as they need to be, or they don't have the technology. And that is an opportunity for all of us to think, what about our neighbor Joe or our neighbor Bob, our neighbor Jose? Like, what about them? Can they access these services? Can they stay up to date? And so reach out to your neighbors, to people who you're like, you might not know about this. Yamhill County Public Health has Spanish language translation. They'll have somebody who can answer the phone and speak to people in Spanish. And then the state has access to dozens of language interpreters. So language barrier shouldn't be a barrier. Reading ability shouldn't be a barrier, and technology shouldn't be a barrier, but we all have to do part of it. That was a long answer, but it's a good start, right? And Joya is typing something to me about age range. Joya, can you ask your question? I was focused on speaking.
Oh, well, Councillor Drapkin had something she wanted to talk about. I can wait. Sorry.
Yeah, that sounds good. Councillor Drapkin, do you want to do a follow-up? You said.
Thank you. Yeah. So one of the things that I've heard, and I have called into the county, but only just a couple hours ago after hearing this, and so perhaps you have an answer in this forum. I have heard that there is a waiting list you can get on regardless of what phase you're in for end-of-day vaccinations if there are extra doses, and that you can get on a waiting list to receive a phone call, and if you can be at the fairgrounds in 10 minutes, there's a chance of getting vaccinated regardless of what your status is. Do you know if that is true or false?
I have heard of people that I know are not in care that have gotten shots, and I don't think they're 80 yet.
So my answer is, if it exists, nobody has told me.
Okay.
And it's entirely possible. Yeah, it's entirely possible. I know that other counties have it. My mom called me the other day because she was so proud of the fact that she was one of the 3 nurses at the Lincoln County Fairgrounds mass vaccination site. And she was like, "You'll never believe what we did." But for her, they have 400 people in Lincoln County who are on that waiting list. And so they just call them up right at the last minute and say, "Come on in." I think it's a great idea. I think it's something that we should consider in our county. And I also know that there are a limited number of vaccine doses out there. And there are folks who clearly need them. And the list of the people who need them and are eligible is very long. So I just want to make sure that we fill all those slots that we have with the people who we know need them because they're either part of a high-risk population or they work with a high-risk population. But to answer, I hope that clarifies a little bit. I don't know of a waiting list. Joya's question was about folks who are 80 and over, and then folks who are, I think, 65 to 80. And what I was saying earlier was that February 8th is the beginning of the eligibility period for elders who are 80 and over. But Joya, one important component of that is that people who live in long-term care facilities have always been eligible from like the very beginning, and in theory they're taken care of through the federal contracting with the large pharmacies. In some cases, the federal contractors haven't come through, and so Yamhill County has done the vaccinations for them. The corollary to that is that there's a good number of people out there, regardless of their age, who have who are homebound or at least stay at home a large portion of time. They are eligible if they have caregivers, medical professionals coming into their homes to provide them with care. And the reason why they're eligible now under the risk-based thinking is because those medical professionals are going to multiple homes to take care of other people, and they all need to be vaccinated. So that also goes for caregivers who live in the home, as far as I understand. So I have a friend who she takes care of her husband who has cancer. She is eligible as well as him currently. No questions. They're just in phase 1A. So anybody who's in phase 1A is automatically eligible kind of going forward. So if somebody who works, a staff member, for example, works in a long-term care facility, if they're eligible now, but they've declined it, they can go back and change their mind and they can immediately get get a dose. I hope that helps.
That did help. The reason I ask is selfishly, my husband's 75, right? and but he has heart disease. So is he eligible or not? It's not clear. He called his doctor, and his doctor was like, "Yeah, I can't help you." So, it's one of, and I think about all those people that are my husband's age who are relatively active and healthy, and they're okay, and yet, my husband's been housebound basically since March, like many of his peers, and just wondered when that might be an eligibility period for them.
Yeah, and I would say, Joya, my best, I have to guess because I'm not the professional. I just read what they tell me. I read what they write. Is that the best thing to do is if he has a question, or if you have a question, is to call the public health number or send them an email at their COVID email address, and they will be able to sort it out. Yeah, good questions. It's kind of intense being the one who has to answer the questions. So suffice it to say that we are moving through the stages and the phases. But again, we have a limited number of vaccine doses that are coming into our county, fewer than we really can handle, but we're making very good use of them. Doses that came in, we got 1,100 doses this week. 1,050 will be administered by the end of the week. And then there's an extra 50 that'll go over into the next week. But that's just a matter of the logistics of who's coming through. And with that, I guess my question would be to engage all of us a little bit more is, Superintendent, what do you know of your school district's ability to get vaccine doses? And thanks for joining us.
Well, you're welcome, and it's a pleasure. So the doses, so there's an event for educators this Thursday and Friday, and the Dayton School District got 43 doses. So the districts and everyone kind of agreed that we would divide them up there's about 2,500, I think, educators, that's preschool, private schools, public schools in the county. And so, and then each school district and each school has turned in how many doses they need for their staff. And so they've been divided up just kind of by what's your percentage, of that, of the 2,500. So for Dayton, it's 43 this week, and then we'll get some more, assumingly next week and the week after. And hopefully in about 3 or 4 weeks, we'll be done with the first round of vaccinations. So that's how that's working. So I think it's a great plan, and it's working well. So staff is happy to have the opportunity.
Great. My understanding, thank you. My understanding of how it works on the front end as somebody who gets the vaccine is that you'll get an email. So we need to figure that one out because not everybody has email. You'll get an email. It'll allow you to, essentially check on the time that you want to be there or your organization. And then from then on, it's a fairly smooth process for most people of showing up with their consent form approved, being in line, and then getting through the process is 25 minutes or so. So the reports are that it's going very smoothly in Yamhill County. Are there any other questions about vaccines? Awesome. And I want to note that Mayor Watkins was successfully joined us now. So welcome, Mayor Watkins. And I also should note that Takesha Wydrow from Sheridan has also joined us. The introductions were a little early. And Joya Goodrum from the McMinnville Chamber of Commerce. All right. With that, I will actually, Councilor Drabkin, did you get everything in that you would like? Okay, great. I'm going to keep this McMinnville centric just for a moment and transfer over to Councilor Menke. Did you have anything you wanted to add or share with the public? And you're mute. You're still on mute.
One would think. I do have some numbers from YCAP where I'm going to be in the board meeting this afternoon, but I thought it might be interesting for you folks to know that YCAP has received $3,647,000 in grant revenue this last year. That's like $2 million more than they did the year before. And they've actually given out in client assistance $2,900,000. So they're they're getting it and they're moving it out as fast as they absolutely can. Just a couple of mentions on the households served on the motel placement stats. 81 total households have been served to date with 141 persons. 73 persons meet the definition of chronic homelessness. 116 adults and 25 children, 46 are seniors over 55. 54 households have exited the program to date, and 100% of the households reported a chronic health condition. So just kind of a brief synopsis of what's been going on there.
Great, thank you, Counselor. And there are any questions for Counselor? Counselor Drabkin.
Oh, sorry, I was trying to get into the chat, but will you send those stats out, please?
Yeah, I'm going to send them out through, I have to send them out through Claudia today.
Perfect, thank you. Before I keep going with cities, Al, is there anything that Congresswoman Bonamici would love to share with us? And welcome.
Hi, yes, sorry, I had my screen pushed to the left so I couldn't find the unmute button. Yeah, it has been a busy week at the Capitol, I would say. I'm sure you're all aware that President Biden has been signing a lot of executive orders. Our office is watching many of those closely. And also when the House, when there's a new Congress, anything that passed the House but didn't pass the Senate has to be reintroduced. So there's been a lot of reintroduction of bills that you may see that sound familiar that you thought already passed last year, which is true, but they do have to get reintroduced again. Congresswoman Bonamici, who serves on the Ed and Labor Committee and the Select Committee on Climate Crisis, just today, I believe the Ed and Labor Committee reintroduced the National Apprenticeship Act, which we talked about a little bit ago, which will invest nearly $3.5 billion over 5 years to scale up apprenticeship opportunities, which Congresswoman Bonamici is a fierce supporter of apprenticeship, and I know that there's a lot of that happening in the county. I see Avisha turned on her camera to clap for that, so that's great. And then the Ed and Labor Committee also introduced the Stronger Child Abuse Prevention and Treatment Act, which is legislation that will strengthen federal efforts to prevent and treat child abuse and neglect. And then while this was not the Congresswoman's doing, but Biden, one of the executive orders that Biden signed, it was rejoining the Paris Climate Agreement, which the Congresswoman is very happy to see that happening and is hoping to work with the Biden administration and the colleagues to implement the Climate Crisis Action Plan. And she continues to push for childcare, which I think I say every meeting, and I'm going to continue to say it. She did send out a letter, which I'll be sending out to folks, and I'll include Commissioner Kula, who can send it out to anyone who's not on my childcare list. But she sent a letter to the Biden administration today pushing for continued relief and support of the childcare industry.
And thank you. Avisha has a question, but I just want to note, thank you to Keisha for letting us know how much snow is at Delphi right now. I'm so excited for you, and our children wish they were with you right now. Okay, but then, sorry, on to Avisha's question.
I know I am jealous of that 3 inches. I'm a little mesmerized watching the snow fall at my house, but it's not quite sticking. Al, thank you so much for your update. And there have been so many bills and acts and things being signed by the new president and things being extended that this is probably an unfair question, but maybe you can offer a follow-up or a suggestion on who I can follow up with. One of the things that Biden did issue just recently was this 400, so it's called the Buy America plan, right? So it's $400 billion in federal spending with American manufacturers. And certainly that's exciting to the industries that we serve. I am curious first of all, that's something I'm going to want to follow. So if you have any additional information that maybe I don't have ready access to through general media, I would love to have access to that. But I'm also curious if we believe or are aware of any activities, is that filtering down to state level at all? And is there a requirement on the states through that program to buy American as well? Is it just a federal plan? So these sorts of questions, again, is probably more fair for a follow-up, but anything on that would be helpful in the future.
Yeah, that's great. I appreciate you coming out the gate saying that. I will send you the fact sheet for it. I'm not sure if you already have that.
No, thank you.
Okay, so I'll just send it to the whole group. I assume that most folks will probably want it, and then I will try to see if I can get any details. My first thought is that probably those details have not been identified yet, but I'm not so sure. So let me look into that, and I will follow back up with you. I'll send an email.
Thank you, Al. And so my request out to legislators is that where there is an opportunity to identify kind of that cascading impact of federal funds to the state for purchasing, that there continue to be those, I know that there are kind of recommendations and requirements in some areas of spending for it to be American made, but there are more opportunities for us to support our American manufacturers. And so where those opportunities exist, we just want to continue to advocate for that. So thank you. Thanks, Al.
Yep.
Absolutely. And thank you for the...
Sorry, I just want to make sure that I have the question marks. I'm going to try to give you as complete of an answer as I can, Abhisha. You want to know that whether or not the federal funds are going to have like state guidelines for implementation?
Right. So similar implementation for funds given to states. So guidelines to Buy American as well.
Great.
Or if anyone's aware, just if our own state is adopting those same sort of things outside of this. But I think from your perspective, Al, it would definitely be that federal designation is my question.
Okay. Great.
Yeah.
Thank you.
Yeah, that's a good clarification. Thank you. Before I keep going through Roundtable, I just want to note that I just got an email from Jody Christensen at Regional Solutions, and she notes, and Joya probably has seen this, but that Governor Brown just announced modifications to the guidance for indoor activities in extreme risk counties, which allow for a maximum of 6 people indoors in facilities over 500 square feet for all indoor activities except dining. And Joya, you can probably help me with this, but that probably means that you can have indoor events, but it would be a funny party with just 6 people. And then gyms, ballet studios, facilities like that as well that were limited to only outdoor. Is that how you would interpret that?
I would. Thank you. Great question. I would think that it means you would have no indoor dining. But everything else, as long as you had 500 square feet and you could have 6 people. So for every 500 square feet, I would read it this way. Maybe you would do the same way. You can have 6 people. So 1,000 square feet, you could have 12 people. Does that make sense? Did you read it that way? I might have to go back and read it again.
I think, well, it says a maximum of 6 people indoors at facilities over 500 square feet.
Go. So,
and for facilities smaller than 500 feet, it's a 1-to-1. Right. I like that, a 1-to-1 customer experience, such as personal training.
Yeah.
Yeah. So I guess if you're smaller than that, then it's probably an issue of there's some science around indoor air exchange quality.
Yeah. And in a lot of places, for example, the really larger gyms have got very good filtration systems. And so, if you're 19,000 square feet, and you've got a really good, filtration system, then the likelihood that you could have more than 6 people, even though you says you can't, you probably could have 6 people in there and it would not be a problem. So it's just depending upon the size.
Right. It's good to see this step, but it's also very encouraging to know that our case counts are going down at a rate that makes me hopeful that we'll move to the next risk category down. But I'm sorry to interrupt, but it felt like, hey, there's something positive happening on balancing public health and people's access to things like workouts. And with that, I'm gonna, oh my gosh, my auto warranty has expired. Sorry. With that, I'm going to move on to Mayor Linda Watkins from the city of Carleton. What would you like to share with people in the community and here today?
I've got to unmute first here. It is snowing and it is sticking, so the ground is white. That's the first thing. Yay, yeah.
I'm having a little bit of FOMO over here in Portland where it's just gray.
I'm sorry. I could maybe take a picture and send it on up to you with that. No, I'm teasing. Anyway, yeah, well, I got in from walking the dog just in time because this started just right after I came in. Other than that, our poor restaurants are, I think the Oregon Health Authority was kind to them and suggested that they probably back off on their rebellion. So I guess they're kind of back where they are. You know, I gave them, Al, the information that you gave me. Of course, at this point, we don't know where anything is on that. So as far as financial assistance, but at least they know that there's, you know, that they're not being forgotten, because especially after today's announcement, I'm sure they're feeling that way. Other than that, let's see, it's been a remarkably quiet week in Carleton. We're just kind of plugging along right now and trying to work on keeping things through and waiting for our new city manager to get here. That will be a big relief for staff. And I think we'll see a lot of things starting to happen then. But yeah, right now it's pretty quiet. So
great,
just
thank you. Are there
track.
questions? Are there questions for Mayor of Carleton? All right, thank you for joining us. I'm sorry it took a while. And thank you for sharing the snow news.
Well, I think the snow is interfering with my reception on the computer, so I'm using an iPad. So if I'm giving anybody vertigo, I'm sorry, but I'm kind of shaking around here. So thanks.
Yeah, thank you. And I am going to move on then to, let's see, I've got Scott Cooper, Joya Goodrum, Abisha, and I want to make sure that Steve Sugg gets to share what he wants to rather than what I've asked him about. But with that, I'm going to make sure that we get to hear from Joya Goodrum of the McMinnville Chamber. If you are available. Yeah, you are.
Yes, I'm just writing some notes of things that I want to talk about. So thank you. Thanks for letting me be here. Appreciate all of this conversation every week. I just do want to recommend, and no, I don't want to recommend, I want to say this. California is opening. I'm just throwing that idea out, and it's great news for California. And I hope that Governor Brown kind of follows behind what Governor Newsom is doing, and maybe we can open. I am very excited to see that some of our businesses are opening. We believe that our businesses need to be open because we support them, and they do better when they can actually serve their customers, right? So PPP and EIDL are up and running. And of course, we've mentioned this to you, 501c6s, which is like chambers of commerce and associations, can apply for some of that assistance. And so I encourage businesses to apply, but to talk to their accountant or tax preparer before they do that, to make sure that they understand the ramifications of what they are doing for their business. And Kathy Bernards this morning on Corporate Coffee gave a fabulous presentation. If anyone is interested in that, let me know. I'd be happy to send you the documentation that she shared with us. We did send a letter to City Council, the Chamber did, asking them to write a letter to the governor to open our businesses. And tonight I think they'll be discussing at least what they're going to do about it, whether they're going to do that or not. And so we'll look forward to hearing from them on that. The legislature opened last week, and over 3,000 bills we're expecting could come down. A couple of them that I thought were important, and I say these because I think I will send that to you, Kelly. there's a PPP surcharge that we're expecting on businesses with forgivable loans. I'm sharing this information. I know this much about them, so I'm only sharing them because I want you to be apprised of it. I'm not saying that they're good or bad. I'm just sharing the information, okay? So they're looking at a surcharge on people who got forgivable loans from PPP. They are talking about limits on charitable contributions based on adjusted gross income. And the third bill that I wanted to mention today would prohibit employers from permitting or requiring ag workers from working in excess of 40 hours per week. I don't know what's behind all of these bills, but it's something that was brought to my attention, and I wanted to share those with folks because it could impact how people run their businesses and what they do moving forward and how they make their business decisions. So I will happily share Kathy's presentation. It's a document, it's, I don't know, 10 pages, but it's really good information because she always does a great job bringing that together. And I'll send it to all of you. How about that? Any questions?
Yeah, thank you, Joya. Questions?
Yeah,
Right. Yes.
Excuse me, I have one. Yeah, Joya, the letter that you were talking about, could you keep me kind of updated on what the council decides on that? Or, I mean, I'll be watching the council as they're working too, but
Sure.
If you could keep me updated on it, or if they decide to do something, let me know.
I can send you a copy of the information that we sent if you'd like.
That would be great. Thank you very much.
Would you put in the chat your email address for me, please?
Yeah, let's see if I can do that on this.
Okay. Thanks. I appreciate that.
Yeah, technologically, I'm in the wrong era.
Well, maybe Commissioner Kula could give that email address to me in the chat.
I figured it out.
You did. Good job.
Yeah.
Okay.
Totally. It's like watkinsl@ci.carleton.or.us. And I just read aloud your email address on something that's going to be broadcast. Whoops.
Oh, well. And actually, you did it incorrectly, so that's not a problem. Sorry.
That's my life.
I'm sending.
It's my life being like a little bit wrong, but assertive about that wrongness.
I'm sending it to Joya right now, so we're good.
So much.
Perfect. I did want to know along those lines is that I'm not sure if Mayor Watkins saw this, but the Oregon Mayors Association just this morning sent a sternly worded letter to the governor's office that I'm happy to share with people as well.
Oh, please.
And
Can I show you how pretty it looks outside my office?
I would love to see it.
Look at this. I don't know if you can see, but look at that pretty snow. Isn't that beautiful?
I just want to acknowledge, Al, that you and I are in the same boat. It's just gray and gray here.
Sorry.
But that's because I'm like 100 feet lower.
I'm glad we're in solidarity with each other.
Yes.
Love it.
Okay.
I got nothing else. Thank you.
Totally sidetracked, but thank you very much. Abhisha, what would you like to share with people today?
Hi, everyone. Thank you, Commissioner. I always love going after Joya because she covers like all the stuff, and I just get to say, yeah, what Joya said. So I'm just going to share one exciting project with you that's going on in Yamhill County, and it regards some funding from the state. So SEDCOR, in partnership with MEDP, OMEP, and a local software developer in McMinnville, Buildable, are working on a project that is an open source ERP system for manufacturers and our processors. So producers, processors, manufacturers. And ERP stands for Enterprise Resource Planning. So it is essentially a software tool that allows for businesses to capture all of their expenses from all of their inputs. So whether that's, human assets, inventory, physical assets, build their cost of goods sold appropriately and go into the market at the correct price. It also encompasses all of their accounting, including AP and AR. And so it is a front to back full system that helps them manage their inventory, helps them to assign cost, helps them to manage all of their documentation and process. And this is one of those tools that are usually inaccessible to our small, emerging, and mid-sized manufacturing companies. and it is a pivotal tool. There is a lot of customization around these sorts of tools, and there are a lot of larger sort of organizations that have software that is just cost prohibitive for these organizations to access. So our great partners at Buildable Works identified an open source ERP platform that they started developing over time. This partnership came together, and we said, this is something that we can really do a good job on and make available to all of the businesses in Oregon. So we wrote for a high impact opportunity project grant, a HIOP grant with the state of Oregon, and we were awarded funding. So we're currently working on 2 pilot projects between now and the end of September, building out a couple of modules, and then commercializing this product. So you will hear us, Scott and I, talking about this. You will hear us bringing this to some of our industry roundtables and sharing this tool kind of throughout the state. You're going to see some formal announcements of this program come out really soon through MEDP and SEDCOR on our social media networks and articles and whatever, newsletters and things like that. But I wanted this group to be aware and kind of let the industry partners who are watching this know that we are working on innovative, fun, exciting projects. And regardless of what pressures we're all under at any time, we continue to move forward. We know that our business partners have their nose to the ground, and I want them to know that we are working on tools and resources that allow them to be more successful and continue to grow their businesses here in Yamhill County, the Mid-Willamette Valley, and Oregon. So that's all I wanted to share today.
Super, thank you. That's very exciting. More awesome in the layman's terms. Yeah, see, I speak layman. Are there questions for Abhishek? All right, thank you very much. And Scott Cooper from McMinnville Economic Development Partnership, what do you want to share with people today besides the intern program?
Yes, good afternoon. I 20 years in the desert, this is just the coolest thing ever. I mean, I forget sometimes that I grew up in Iowa, but it's too cool. I would like real quick and kind of touch on, bounce off of the apprenticeship conversation and where that's going. And McMinnville Works, we're in our 9th year of the internship program. We are still, we're open for host sites. So if you're a business or a manufacturer or any business that can use an intern for the summer, please reach out to, you can reach out to me, Scott, at McMinnvillebusiness.com. I just got there, Casey. So, or McMinnvillebusiness.com on the web, and you can find information on that, or you can reach out and get a hold of us if you're interested. Also, the applications are open now for both sides. The Works program, which is our collegiate-based internship, and Bound, which is our high school graduate program that's focused a little more on grades. Those applications are being accepted as well, so we will be going through those here in the next 4 weeks or so, and as we get ready for the summer program. We're excited about it. It's been a great program. It's a great way for us to grow our own workforce here in Yamhill County, and make those aware of the opportunities, and quite honestly, the terrific opportunities that are available to them, either as high school age kids or graduate, our college or collegiate level kids as well. That's really about it. And Abhishek, thanks for mentioning the HIOP thing. It's not often that we get to. What we do is great, and it's wonderful. It's a lot of fun. But when you get to do a little twist on something that's pretty unique and specific, it's and something that you can branch out to help such not only your region but the entire state is a really interesting thing to do, and we're really proud to be a part of that. So thank you. That's it.
Awesome, thank you, Scott. Any questions for Scott? All right. Superintendent Sugg, I wanted to make sure that you, I asked you about vaccines, but you have a lot more going on. What would you like to share?
Well, first of all, I think the snow is coming your way, Commissioner, because it's now snowing in Dayton. So it wasn't when we started. So maybe it's coming.
It is now.
So, but, we're hopeful that with the vaccines, we've got limited in-person instruction going on in the district, and we're certainly hopeful that with the vaccines and the case counts coming down, as you mentioned, that we'll be able to get to that much pursued hybrid model sooner rather than later at this point. So really, we're very aware that, March 13th is kind of the one year mark since, since schools were kind of closed and stopped in-person instruction. So we're just excited about that and working to get kids back in the building.
Great. While we have a superintendent here, are there any school questions? All right. Well, thank you for joining us again. It's great to have you here. Any final thoughts? All right. And regarding re-upping the vaccine conversation, we've moved on, or we haven't moved on. We are able to start vaccinating people in phase 1B, which starts with people who are associated with schools and childcare. We'll move on to folks who are older but are not in a long-term care facility or medically fragile. But any folks like who are older and who have a question about whether they are eligible now, reach out to Yamhill County Public Health, and they can be the ones to make that determination.
Define
we'll get this
older.
Done. Great question. Earlier I was talking about how starting February 8th, people who are over 80 are automatically eligible for vaccine doses. But right now, anyone who is in a medical condition at home, so not in a long-term care facility, who has a medical provider coming into their home is also eligible for the vaccine through phase 1A, and their caregiver. And I have a question from somebody in my email inbox asking, is somebody who's not a medical provider, but who's providing care to a medically fragile individual, do they qualify? And that's really a question that public health can answer. It's one that I'm pretty sure they will say yes about, but that really the concern is having the medical providers to come into your home to take care of somebody and then go to another person's home and go to another person's home, because that exposes everybody to that risk. So the state is very, very keen on getting that person vaccinated and the people in the home. Hopefully that helps a little bit. But when in doubt, call the phone number or email them at covid@co.yamhill.or.us. All right, great. Thank you, everybody. Take care out there. Keep your distance from other people. We're going to get through this. And it's been a pleasure to be with you today. Enjoy the snow.